We begin today with those new rules in Ontario schools. Starting this fall, the government will ban vaping on school grounds, and parents of students caught breaking the rule will be notified. There will also be new restrictions on cell phone use. Students in kindergarten to grade 6 will be required to have their cell phones on silent and out of sight all day. But for grade 7 to grade 12 students, cell phone use is entirely banned during class unless otherwise allowed by teachers. The province will also ban social media platforms on school networks and devices.
Overwhelming, like it's staggering numbers, the numbers I've seen with parents supporting the ban because they want their kids to go to school and learn, not to be on social media and fiddling around with their cell phones during class.
Ontario Education Minister Stephen Lecce joins me now. Minister, welcome back to the show.
Thanks so much. Good to be back, David.
Minister, I remember in 2019 you banned cell phones in schools. Now you're banning them again in 2024. Why is this ban different than the old ban?
Well, in 2019, the government of Ontario announced a requirement that school boards produce a plan to restrict cell phone use in schools. Some had strong plans and most did not. And here we're at the point where we have a patchwork without enforcement, and with many school boards really asking the province, sort of saying, look, we don't have the solution. And I saw the data. I've seen the data on the distractions in schools, the impacts it's having on academic success and mental health. And I think all of us, everyone, any parent, any teacher will acknowledge there's a problem in our school system. And so we've learned lessons from 2019. We're not going to allow school boards to build policies, some of which could be strong, many of which were weak. We're going to set a high standard province-wide with enforcement, mandatory learning and curriculum, and new resources province-wide to support addictions and mental health. So there's a variety of lessons learned from other jurisdictions who attempted to do this. And I have confidence that the plan is comprehensive and fundamentally it restores a sense of academic rigor and safety and common sense back within Ontario's school system.
Okay, so essentially last time you gave them the authority to come up with a plan to implement a ban. This time you're implementing the ban and you'll give them the ability to come up with exemptions as required if necessary. For example, if a kid has a learning need or a medical need and they need a phone in school, they can have those exceptions there. That's how this will work.
So we created the exceptions list. We will impose that on school boards. We have really set out the policy with specificity at the provincial level, and we're requiring school boards to implement it. Essentially a policy that was developed from the top, really developed from the bottom up when it comes to speaking to students and parents and educators and health experts, but it will be enforced from the top down. I really think that's important, that we have a provincial standard, a broad set of expectations, and an emphasis province-wide on the back to basics agenda. And I just think government needed to step up at this point. And how many more data points do we need as a society until governments have the courage to bring forth strong, robust, comprehensive, compassionate policies that change behavior and fundamentally for the better, change the culture in schools.
Okay, I want to talk about the enforcement in just a sec, but you say you've seen the data points. What is the data? What is it you've looked at that makes the case? Because in the scientific community, there is not a consensus on this, that banning cell phones automatically leads to better academic outcomes. So what's the data you've seen that has convinced you, and will you make it all public?
Well, we're restricting cell phones. I mean, I just want to be clear in the language. There's not an outright ban, because if you're right, that has not worked in most jurisdictions. We have restricted during instructional time. That's the policy. When you're sitting in a chair in front of a teacher, we're giving the authority and the teeth to the educator to use their judgment on when technology is a value add and when it is not. But with respect to the data, I mean, CAMH has a study that's been produced on the use of smartphones, that over a third of these kids are spending more than 5 hours a day on their smartphone. There's a study from UNESCO that came out just in 2023 that reaffirms the negative link between cell phone distractions and the ability of students to refocus. It takes usually up to 20 minutes just after looking and scrolling for 1 minute on social media. EQAO data. I mean, David, we still have in this province, and I'm sure it's the case in many jurisdictions in Canada, where more than half the kids are not meeting the provincial math standard. So I just believe objectively, based on academic data, let alone mental health data that's coming out of CHEO and CAMH, and of course, the Hospital for Sick Children, the message is, I think, the government needs to bring forth a plan that refocuses schools and children on academics, that gives teachers authority. And I think a great lesson learned for me is that we have to back our teachers, back our principals, back our superintendents and school boards. And the message I'm sharing to parents, because just this afternoon, parents received a letter from the government, from myself, outlining those expectations. And I want families to know that we in the government have the teachers back. We will support them. dispassionately implementing and enforcing this policy. And I want them to hear that, because I think in jurisdictions, I mean, Quebec and other jurisdictions, they didn't. A lot of educators have told us we didn't hear that message, and then principals didn't enforce the message. They didn't really have the. They feel like they didn't have the license to do that. So this is a different approach. We're going to start with prevention through curriculum, mandatory learning on responsible use of technology,
Right.
online citizenship skills, and obviously the perils of vaping, cannabis, and tobacco. Ever since the federal government legalized cannabis, we've seen an explosion of data that suggests that Ontario and Canada have among the highest vaping and cannabis rates in the industrialized world. So we have a problem. We have a plan to deal with it. It's serious, but it starts with education. It really is about embracing the concept of prevention opposed to enforcement. But yes, we do have to have teeth. We have to have deterrence, and we have to signal to parents and kids we are serious about changing the culture in schools.
Okay, I want to get into that. And just for people listening at home, CAMH is the Canadian Association for Mental Health, for people who don't know the acronyms, just so they can know who you're referencing there. But you say you'll get the teachers' backs, and you sent a public messaging on that. But you're not going to be in the classroom, right? And there have been concerns expressed by teachers and teachers' unions that they're going to have to seize cell phones and take cell phones away if people don't comply with the policy, and it puts them in a very difficult situation of doing that. And they're concerned about who is responsible for, say, a cell phone that is taken away from a student and something happens to it, or it goes missing, and creates challenges that way. How do you deal with those concerns? Because this is a blanket policy, as you say. So how do you deal with those concerns being raised?
Well, the first point of this policy is that it respects the professional judgment of educators, and I will respect the judgment of educators when technology is of value and when it is a hindrance to learning and academic achievement. So I will respect their decisions. And when the teacher comes in, the default in September is out of sight, out of mind, and kids are on their phone, they now know that the ministry has codified a progressive discipline policy and that asks them to, in good faith, try to change the behavior of the child. But if they're not able to follow the clear direction of the teacher, there can be progressive discipline steps in place. We're going to be training our educators. Another lesson learned from jurisdictions east and west of us is that they didn't do sufficient training on classroom management techniques, how to create this change, how to create buy-in of students. And we're also going to be democratizing the progress of kids. I think parents should know from a transparency perspective. So we're going to ask teachers to include in the report card. We're going to standardize that across Ontario.
How do they assess that, though, Minister?
To measure.
How do you assess the level of distractibility? I noticed that. I've got a couple of kids in school. How am I going to know on the report card what, like, I know A, B, C, D? How does it work in this sort of metric?
So some teachers today already do this. They literally will say your child is very distracted in school, or your child is, incredibly attentive. So they usually include knowledge comments in the comments section, but it's not universal. And I would submit a minority of teachers are doing that today. I want to standardize that. So teachers use their own judgment about the capacity of the student to learn, to engage, to collaborate with their colleagues, to debate civilly and build those social emotional communication skills. For me, this is really just from a broader, almost like an existential challenge for our society. We have young people who cannot communicate anymore. I feel like our school system in the West has lost its humanity. We aren't strengthening those imperatives of being able to communicate and share and collaborate and fundamentally think critically. And so this is a rethinking and a reimagination of education around core educational principles, back to basics, like reading, writing, and math. We will benchmark improvement. We're going to look at data like literacy and math. EQAO in Ontario, it's our standardized assessment system. We can literally assess academic improvement and mental health improvement. And that is the aim of this policy reform. For vaping, it's the same principle, but it's a much more absolute policy because it is illegal to vape if you're under 18 anyway. You shouldn't be owning cannabis. You shouldn't be owning tobacco or any of these things. And yet they become safe spaces in schools. And to your point about the 2019 policy, I'm sure it was well intended, but it didn't have the effect or the teeth. So this policy on vaping was actually born from student trustees. I asked a simple question: what would change your behavior? And they all said to me, if you called my parent. And so the first step in the policy is to call the parent, inform them that their child is vaping on school property, remove the device, not return it. And of course, engage addiction services for those kids that may need it.
Well, that's where I wanted to go, Minister, because just say punishing a kid for vaping on campus. I mean, when I was growing up, people smoked, by the basketball courts, so there was no vaping.
Right.
So it's a similar sort of challenge, though the health risks of this and the addiction levels of this are also severe. So how do you deal with the addictions issue? I get it. You punish them if they're smoking in the bathroom, smoking on school grounds, but there is a shortage of capacity to handle addictions as it is right now. So how does this work in this plan?
Yeah. It's just important to recognize that we can't just bring a hammer we're not going to change behavior. We're going to have to bring people along. So part of this is education on vaping. We already have mandatory learning on the perils of vaping cannabis in our physical health curriculum. We're going to be massively expanding it, bringing it to earlier ages for young kids to really understand the risks and the importance of personal responsibility and just understand what they're doing and what they are inhaling. With respect to the question, we've brought in a $30 million investment for vape detectors. That'll help to create greater transparency for the staff when vaping is being used. In one board in Northern Ontario that piloted these detectors, they saw a significant reduction in suspensions, in graffiti, and perhaps most relevant, the reduction in vaping in their schools. So we want to model that across Ontario. And then with respect to the role of mental health supports, we get that. We totally understand the importance. It's why we've stepped up with an investment of an additional $15 million to leverage community-based healthcare for addiction services. Yesterday, the announcement, CAMH, as you mentioned, a leading Canadian Centre for Mental Health and Addictions, came out to endorse the program, particularly on vaping, because they recognize that we have high rates of utilization of vaping, and we don't have enough deterrents, and we aren't engaging parents and community sufficiently. So this is about connecting the dots and helping use community capacity to support our kids. Of course, we're increasing funding for mental health in schools too, but we're really looking at this through a compassion lens, because at the end of the day, through Hearts and Minds, we're trying to change behavior, change the daily routine of a child to where they can live without the dependence on, for example, a vape. And many of these kids are using vaping for a variety of other reasons, dependency and coping mechanisms. And it's sad, I think, for all of us to see this happening. It's been normalized, and I think that should be a worry for our society and as a population.
Right.
That's why the government and the premier said, "Look, we got to do something about this." I mean, how many studies do we need? How many years of consultation? Like, get on with delivering change in schools. And that's why we said when we were going to go back to basics, it really starts with this, with establishing focus back in schools.
Okay, Minister, we got to leave it there. And thank you for correcting me. It's the Centre for Addiction and Mental Health, not the Canadian Association of Mental Health. I got my acronyms wrong. Ontario Education Minister Stephen Lecce, thank you for your time today.
Thank you.